Okay. So, Assalamu alaikum, everyone. Welcome to this Sunday storytelling session. And I am Sneha Bakal, your host. I am a homeschooler mom of my two toddlers. I am a passionate teacher and a birth doula. So, my birth experiences with my two sons have got me to this work. And I'm glad to be trained by my mentors. And in this work, I feel more solace and contentment, and I love to see babies taking their first breath. That's about me, and I'm from Mumbai. So today's guest is Prity, who I think I know her since few months now, and I had an opportunity to meet her in one of our doula retreat. So let me add her. Yes. So welcome Preeti to Sunday storytelling session with Birth Alive. And so I was saying that I met Preeti in Goa, where we had spent a good time listening and looking at her steaming box. So yes, she's a mother of two daughters, two beautiful daughters as she is, and she's a womb steaming practitioner in Mumbai, the first practitioner I guess in Mumbai, and
India.
in India. Wow,
Yeah.
and she loves narrating her story, as well as she wants to spread this awareness among the mass, that how much it is important to take care of our wombs, who does a great job in nourishing and nurturing our babies inside. And so she's a postpartum doula, and womb steaming comes under postpartuming. So here you are. Thank you so much for joining in, Preeti. I'll pin
Thank you
you.
for having
And
me here today, Sneha.
Preeti, can you wear your headset so that when it is recorded, we would be like good audible.
Is my voice not clear and
It
audible
is
enough?
it is clear, but I think it should be more louder.
Okay. I'll talk louder because I
Yeah.
haven't connected and I haven't charged my headphones, so
Okay.
I
Okay.
won't be
Okay.
able to do that.
Okay.
I welcome all the wonderful ladies here. Thank you so much for joining in. Uh, like Sneha just said, I am a postpartum doula, but to begin with, I'm a dentist by profession. I don't practice dentistry as of now, but that doesn't mean I don't want to. It is just that I have my daughter around and I want to do things being around her, and which is why I chose to do this. I am also a prenatal postnatal yoga instructor. I specialize in something called as diastasis recti, which is very common postpartum. So I do sessions for it online. I'm a vaginal steaming practitioner. So, like Sneha was saying, that this has been a very common practice when it comes to postpartum. But while I was studying about this practice, I got to know that this is not just for postpartum, but for each and every woman, right from teenage to menopause and later, with or without any kind of menstrual related issues. So you can use it before conception, you can use it during your labor prep, you can use it during postpartum. It is helpful with PCOS, endometriosis, fibroids, itching, whatever issues that a woman might face when it comes to your womb, that is your uterus or your perineal area. This practice helps you do that. Also, after the babies, the libido goes down, the sex drive goes down. So this helps with that as well to increase the sex drive, especially after the babies. So yeah, this is what I do. So yeah, how do you want me to go about to share my conception story with steaming and then go ahead with my VBAC story, or to start with the VBAC story?
So I would like you to start with your first baby's birth, and birth story from the first baby, then your conception of the second, and how did steaming help, and then your VBAC story. Yeah.
Okay, okay, lovely. So, yes, I conceived my first daughter in around 2016, and that was not a planned baby. We just conceived, and we were happy that I conceived. I was almost 32 years old then. So I said, it's already, I'm already late. So let me just, we can go ahead with the pregnancy. I was already a prenatal, postnatal yoga instructor. Then I had started training pregnant mamas and new mamas when it came to yoga. And while I was doing that, I was also practicing for myself. So I was so mentally prepared and positive that I want a normal birth during my first, with my first child. And when I was looking for gynacs also, I was looking for more natural options. That how many percentage of natural births have this doctor had. So I chose one lady in Mulund, and she kept saying that yes, everything is fine and you're going to have a natural birth. I crossed my due date. It was over 1 week, so she kept telling me that we need to plan now for a C-section, and I was very sure that I don't want to go ahead with induction or with C-section. So I kept pushing her, saying that these dates are not right. My astrologer has told me that yeah, these dates are not right. So let us just wait until so and so date. And just before that, I started with natural labor. And uh, in spite of being a prenatal, postnatal yoga instructor, there are so many other aspects when it comes to labor prep and birth as such, which I wasn't educated about, I would say then. So, and also some birth stories which I had heard where mamas would say, "Oh, I delivered so easily, I started with labor pain, and just in half an hour, my baby came out." So, as soon as the contractions started for me, that was at 11:30 in the night, I was like, I want to go to the hospital now. My baby can come anytime, not knowing that this is just the beginning of contractions, and it might take hours or it might take even 1 day to get to the peak. So we rushed to the hospital. When the doctor checked me, then I was just 1.5 centimeter dilated. So I was just told to wait. I had taken my big ball. I was sitting on it, moving around and walking, and until morning, I think 11 o'clock, I still wasn't dilated enough. It was just 1.5 centimeter. And she said, let's induce. So she gave me the Pitocin medicine, and contractions started coming in sooner, but I still wasn't dilated much. And the pain was so terrible for me then that I said, I want to go for a C-section now. So I'd almost, since my contractions started at almost 11:30 in the night, and until 1 o'clock in the afternoon, the contractions kept coming, but I was still just 1.5 centimeter dilated. So which is why I said I don't intend to wait more, because I'm just not able to take the pain. And then the doctor said, the baby has passed mupinium, so let's go ahead with C-section. So that is how I had my C-section. But it took me months to get over it mentally, that I had to go undergo a C-section, wherein I was so physically prepared for a natural birth or a normal birth. But when it comes to birth, how much ever physically prepared you are, I feel you also need to be educated enough on this as to when to reach hospital, and what are the things that you need to ask your care provider, that how long can we wait, and when do we take like medically inducing, when do we do that. So I think that those questions I completely missed. I also missed on asking about on the epidural bit of it. So I never took an epidural. I hardly knew about it then. This was almost 7.5 years ago. And then we had a loss. We lost our daughter when she was 1.5 year old. And because of the trauma and grief that I was going through, I think that uh, led to cyst and terrible pain in my uterus. So the pain, generally when we get pain, it is during our period, so just before our period. But this was like terrible pain in the mid cycle during the ovulation. And I went to a gynae, got a sonography done. She said this is a cyst, and you will have to either conceive immediately or you start with birth control pills. My cycles were regular, like 30-day cycle exactly, so I didn't want to start with any medication. And we had just lost our daughter, that was hardly 2 3 months since then, so I didn't want to conceive again that soon as well. So I started with homeopathy medicines. My homeopathic doctor told me 6 months, and the cyst will be gone. So I took medicines for 6 months, but the pain wasn't going at all, which made me feel that my cyst is still there. So after 6 months, I just stopped the homeopathic medicines randomly, and another 6 months I went on with the pain. Every mid cycle, I would pop in cyclopam after cyclopam because the pain was so terrible that I had to take medicine and just lie down for that one day. And then just before the pandemic, that was Feb 2020, I went in for another sonography to see where the cysts are, whether they are there, whether they have gone by itself. So I went in for that. Now the cyst size had increased and it had turned into endometriosis. I went to another gynae to see whether I will get some other natural opinion for this, but even she said that you will have to start with progesterone tablets, and you will have to undergo a laparoscopy when and if and when you want to have a baby again. Again, I didn't want to do either of it. So, and then came the pandemic, and I was reading more about postpartum rituals which were there here in India, and one of it was steaming. And while I was reading more about it, I got to know it helps to cure naturally your period related issues. So I tried that for 1 month, and the terrible pain that I had during mid cycle, that kind of went away like magic in just 1 month. And which is why my faith in this practice of steaming increased. I got myself professionally trained in this practice so that I'm able to help women. And I conceived naturally without any laparoscopy, without any medicine. I did my steaming during my labor prep because I wanted a VBAC. I educated myself so much about VBAC, and when I chose a care provider, a gynecologist here around in my area, it was the pandemic was still going on, so I wanted somebody who's closer to me, and she was also into water birth, and she was into natural birth. All the friends who were delivered at her place, they all had natural births, but all of these friends had their first birth with her, and which is what I missed, that this is my second birth, and I want my second birth, that is after a C-section, to be a natural one, and which is what I never asked anyone. But I told the gynecologist just in the first appointment that I want to go for a natural birth this time. I have had a C-section for the previous one, and she said this is too soon to even comment on it. We will wait until the third trimester, and then we will think about it. Then again, in the second trimester also, I reminded her that I want to go for a natural birth, and she said, "This is too soon. Let's reach the third trimester." I said, "Okay." When we reached the third trimester, also 28th week, I told her that I want a natural birth, and she kind of ignoring what I'm telling, and she kept telling me that around my 32nd week, she told me that around 38, 39 weeks, we will start to plan now. And that got me really irritated, that why plan? Because all my pregnancy is going fine. I'm healthy, I'm exercising. And this pregnancy, I made sure that I'm exercising enough because I want a VBAC. And while I was doing that, preparing myself physically, this time I was also preparing myself mentally and gathering all the knowledge when it came to VBAC. So there are certain VBAC support groups which are there on Facebook, not from India but global. And I became part of two such groups where they shared their VBAC success stories every single day, And I wanted to be around such people where there are positive stories that they are sharing. So while I was preparing myself mentally very positively for having this birth, I was, like I said, I was asking care providers. I also had a midwife with me whom I was doing online consultations with her because she wasn't based here in India. I had a doula with me who I was connecting with online on Zoom. So they really prepped me up with my knowledge as to what is the right kind of knowledge that I need to have. Especially when it comes to VBAC, they are worried about the scar thickness, that how thick the scar is. Also, what is the distance between two pregnancies? How are they placed? And I knew there was good enough distance between my two pregnancies when I went in for my sonography at around 32 weeks. Even then, I checked my scar thickness; it was good enough, and I was constantly in touch with my midwife, so she kept prepping me up that all is fine with me, and I am a good candidate for a VBAC. So, which is why when my gynac what who kept telling me that we will have to plan around 38, 39 weeks. I wasn't really happy with her. So she told me that you bring your husband. So I got my husband in the next meeting, and she was trying to play with our fear and our emotions because we had had a loss. She was trying to tell us that you wouldn't want to happen anything to this child also. And I knew my child is fine, and I am not at all hampering the health of my child or my health because I was well educated as to what is right, what is wrong in this. I was listening to enough positive stories when it came to VBAC, and these were not just VBAC stories from hospital, but these were VBAC stories from home birth also. So I wanted to have a home birth, and I was trying to prepare myself for it also. But when I went to this gynac with my husband, the next appointment, she's telling me that nobody is going to give you a medal to have a normal birth, or nobody is going to give me a medal to give you a normal birth. And that was kind of total no from me from that moment of time, that post this I am never going to go to her. So in my 33rd week, I went and saw another gynac, and at the same time, there was one story that another doula had posted about attending a VBAC with this particular gynac here in Mumbai, and she's like hardly 5 minutes from my place. So I went and saw her alone this time. I didn't even tell my husband that I'm going to see her. I just went for an appointment alone, and I asked the questions that I wanted to ask her. That have you done VBAC? She said yes. Are you open to doing more VBAC? She said yes. And do you do water births when it comes to VBAC also? She said yes. I said, are you open to doing a home birth? Are you confident to do that? Because we were like hardly 5 minutes away. The hospital was 5 minutes away, and even she stayed very close by, like hardly 2 minutes from my house. So that even if anything happens, if we have to shift you, we can do that, even at the last moment. But my husband was scared about this, so I said I need to respect his feelings also because the loss was not just mine; it was for him also. And every time I was educating myself, I was also educating my husband that these are the pointers that you need to remind yourself and you need to remind me while I am in labor. The first time around, he was sleeping on the bed, which I was supposed to sleep, and he literally did nothing. And so, which is why this time I said I need to prep him up also how he will support me because the pandemic was still going on. It was in the second or the third phase of the last phase of the pandemic. So, and that is when my doula said she won't be able to reach here in Mumbai. And the doula in Mumbai whom I contacted, I didn't know Sneha then I think, and I reached out to another doula and she was super busy. She was packed up during that time, so I said okay, I will go without a doula. And my husband was no less than a doula for me. He had his camera in one hand. He was in a gown there, holding my hand with another hand of his. And again, this time when so my water broke when I was in the house. Even that happened at exactly a day before my due date. And but this gynac never told me that we will induce you, or we would prep you up with some things. But there were natural things which I knew that which will help to induce naturally. One of it was steaming, other of it was sex. So, and perineal massage and eating pineapple, eating dates. I was doing all of that so that I was uh, wanting to reach labor naturally, so that the labor comes naturally. And just a day before my due date, my water broke. I was still there in the house because the contractions were very mild, and we waited for almost 3-4 hours in the house. Then the contractions, when they started coming in closer, every 5 to 7 minutes I was getting, and it was staying until 1 minute. So we went to the gynec, and she told that okay, now you can stay. But when she checked again, I was 1.5 centimeter dilated, and the pain was so much. So that kind of got me flashes from my first birth, because the intensity of pain was so much. And again, I was stuck at 1.5 centimeter. So she said, okay, we will wait for a couple of hours. She went, she came back at around in 3 hours. She checked me. I was still only so much dilated. And gradually it increased to 3, 4. But the pain was so much that I couldn't take the pain. And like I said, it was, getting me flashes from my previous birth. So again, this time, I was like, I cannot do it anymore. I want to go for a C-section. And even the gynac, she was getting a little, she was fluctuating that, yeah, let's go for a C-section. But this time, I had kind of pissed off my husband so much, saying the whole of my pregnancy that I want a VBAC, and you need to do this, you need to do that. He said, nothing doing, we will take an epidural and we will wait. We are not going for a C-section. So he was the one who was taking the decisions, and not even the gynaec. So we took the epidural, and it was couple of hours that I still wasn't dilated enough. So I think this time the doctor kind of manually, she opened up the pelvis and we started seeing the baby. Also because of the epidural, I was not able to really push, because I didn't feel anything down there. So I was not able to push. But yeah, so they had to use the forceps to have the baby out, because the baby was kind of stuck there at the pelvis. They could see the head for almost 30-40 minutes. So then the doctor said it is not a great idea to have the baby just stuck over there. So which is why, and also I was losing my patience, and everybody kept saying push, push, and I didn't know, how do I push, because there is nothing, no feeling that I'm feeling down there. It is all numb. Which is why I said, okay, you use the forceps and let the baby be out. And when we saw the baby, it was again a baby girl. So for both of us, it was like a moment where both of us were kind of numb that, oh my God, we have our daughter back. And we just, I couldn't stop saying that, I have my daughter back. And my husband was like totally quiet, just not able to even realize that yes, this is something that has actually happened. But all this while, he was holding my hand tight throughout. And also because he was a doctor, I think the doctor was okay to have him around. And he had also told the gynaec that my husband is going to be there inside. During the first pregnancy, in spite of me telling the gynaec didn't allow him, also because it was a C-section. And there were so many people around, my mom, my mother-in-law. She got in my our neighbor also then. So there were so many people in the labor room then. So this time we had told both side of the parents that nobody is coming to the hospital until we deliver. but still my in-laws were there. They were waiting out, and that kind of bothered me that I said no, I don't want you, but and you didn't respect my feelings, but that was part of the story. But nobody was there around me in my vision, that it was just my husband, and that is what I wanted, that my husband should be there and nobody else. And I had made a board with all affirmations on it, my baby's picture on it, and beautiful lights, tea lights, and I had carried even that in my room, that was there a part of my labor room. And we had kind of dimmed the lights. So this was the kind of ambience that I had imagined, or vision, that I want my baby around while with this kind of ambience. And I was able to do all of that. As soon as the baby was born, I told the gynec that I want a delayed cord clamping and I want my baby to nurse. So they gave me the baby, but she cut the cord immediately because she saw some bleeding and she thought that it is to do with something to do with the scar, whether there is some rupture there. So which is why she sutured me immediately. She cut the cord, and that was one part of my birth story which I wasn't happy about then, but we were so elated with the thought that we have our daughter back, and I was able to have a V back. So nothing else kind of mattered for us. Also, I didn't want my baby to have bath. I didn't want my baby to be vaccinated immediately. So they just cleaned up the baby. I had taken my own clothes for myself and for the baby. So we were using that. I think around when we were leaving on the third day, that was the day when I allowed them to give a bath to the baby. Also, I was there all throughout. And as soon as the baby was held after the birth, she was latching, she was drinking milk, she was sucking. How much was coming, I don't know, but she was sucking for almost half an hour. She just didn't want to leave. And for me also, even I didn't want to leave because that was something that I missed for so many years. So I just wanted to keep holding her and not keep her even down next to me. And I had sutures. So during while I was staying in the hospital for 2.5 days, the doctor kept telling me clean it with betadine, but I don't know how much was betadine even helping. So I was hardly able to sit on the bed also. But when I reached back home, I had already prepared my herb blend, which I could use for steaming, and the same blend is used for sitz bath also. So I prepared that. I had told my mom everything about it. How is it to be used? So I had got a huge tub, and all these the herbal tea that was made with that herb, Epsom salt, and I was sitting in that instead of betadine because betadine didn't help me in the initial few days at all. So which is why I started with this. It helped me with kind of self cleansing that area while where I was little scared to even touch because I had sutures there and I thought I might kind of hurt myself. So I was scared to even clean that area. So while I was doing the sitz bath, it really helped me to kind of self cleanse, and the water was warm, so it was helping me to heal. I was doing that twice a day, and in just couple of days, in I think 2 3 days, I was able to even sit well and nurse well. So I have a good friend of mine who is a lactation consultant here in Mumbai, and with both my babies, she was there immediately on the first day to help me with the latch. And post then, we never had any issues latching. So this is also something that I feel that it is important when somebody is just coming you and showing you the right class so that you don't have issues with breastfeeding in the initial couple of days, and that doesn't put a negative thought on your mind that, oh, I don't want to continue with breastfeeding. So while we were in the hospital, the doctor kept giving some formula, and because of that, my daughter was, kind of spitting out, and for that, the doctor wanted to give Domstal, saying that it is, causing acidity. But when we reached back home, we never had any formula ever. She's 2 years and 4 months now, so never formula, never any other milk. And Yeah, postpartum was hard for me, I would say, in spite of all the preparations, but how much ever prepared you are, you don't know what you're going to face. So, but I had the right kind of resources whom I need to reach, so which is why I was able to recover from postpartum anxiety and depression sooner and in a better way. And there were a lot of the practices that I did around my postpartum because I had already done my postpartum doula training. So I knew the right kind of foods that I need to eat for those first 40 days. There was belly binding, there was the steaming that I did, uh, and resting enough. So I had enough support with me who could help me with my baby and to do everything around in the house so that I could just sleep and nurse the baby. And yeah, this has been my VBAC journey and my journey with birth with both my daughters.
Yeah, it was heartwarming to listen to the story and the moment when you described that, the baby was out and you could feel that, your daughter is back and your husband taking a stand, sub, a solid stand, which which kept you going. That was amazing. The idea of having an epidural and resting for some time and and the body opens up and you gave a birth. So Preeti, I would like to know that. So what was that difference? As you said that you did a lot of preparation, you went into Facebook groups to understand what is feedback, and you made sure that you are around the positive birth stories and not the negative ones. But you were still with that same guidance. You had been visiting till 33 weeks. So and when you felt that the gynec where you can birth naturally was just few steps away from your house. How did that moment felt for you?
Yeah, it was great. I was confident enough, like I said, that for me, VBAC is very much possible. I am not going to take a no from you.
Okay.
Irrespective of whatever you say, I
Yeah.
am not going to take a no. So, which is why I was willing to change. And like I said, you need to be well educated on this. And when you are educated, you can tell everybody around you that I know what I'm doing is right for
Correct.
myself and for my baby.
Yeah. So
And
among the preparations you did from the first and the second birth, so the first birth you just wanted to have a natural or a normal birth. That was it, right? And the
yes,
second birth, what preparations did you do? And can you please name your doula and your midwife so that I think they need acknowledgement for holding you throughout the process. Though they
yeah,
were
I
not present in the birth, but still they were there, a major part of your pregnancy.
yes, yes. So I think major credit goes to my midwife, that is Donna. She was a midwife here in the birth village, and just before the pandemic, she had moved back to the US. But during that time, she mentioned that she might be here in India, and she was willing to travel. But irrespective of that, like every month I would go for a consultation to my gynac. Every month I was doing one consultation with Donna also on Zoom, and she was willing to answer anything and everything. She
Yeah.
was telling me from what I can eat, what are the exercises I was well aware of that I can do this. But when it came to putting on weight, my gynac literally kind of terrorized me that Priti, you cannot be putting on so much weight. So every time I was going to my gynac, I would be like really scared that, oh, I will have to go there and weigh myself.
Yeah.
And what if my weight is increased? But
Mm.
it was okay.
Yeah.
My midwife was telling me, that you can calculate the number of calories that you are having, and during pregnancy, you're supposed to have so much of calorie of food. So you just calculate. If you feel that you are overeating, you can just calculate. And also it was pandemic, so we were hardly able to see people, so all that was coming. I think for me it was, I was relying on to food was my solace then.
Yeah.
So which is why I was putting on weight also. But I was exercising at the same time. I was doing like hardcore workouts every single day. And this was not just simple yoga stretches. So I was burning enough calories also while I was eating so much. And the consultations with Donna would be like 1.5, 2 hours, and she would happily answer all the questions.
Yeah.
So
That's the difference between the gynecologist giving their 10 minutes of their time and we being terrified, and the midwife speaking to us until we feel satisfied.
yeah. And she would not only answer just about physical things, but what I'm going through emotionally, what questions do I have when it comes to labor, what fears do I have when it comes to labor and birth. She would answer all of it patiently. And I hadn't taken iron and calcium tablets all through my pregnancy. My gynaec had prescribed me. I started initially, and then I was off medicine completely throughout my second trimester. And Donna had told me that it is during the third trimester, around 28 to 32 weeks, that the iron dips down.
Yeah.
If it dips down, you can start with your iron tablets then. But I was already taking natural infusions, herbal infusions, which would help to increase calcium and iron. So, which is why I was not worried about that. And yeah, when around my 32nd week, when we did a blood test, my iron level, my hemoglobin level was a little low. It was after that I started having iron tablets and calcium tablets. Even after the baby, I didn't have any iron and calcium. I completely stopped. I was not having milk, where people kept telling that, you need to drink
Need to
milk.
drink milk to get milk.
Get milk, yeah. So for the initial first 3 months, I think I had milk, and after that, I completely stopped because I was never a milk person. As in, post my first pregnancy, I stopped having milk. I was trying to be vegan, so I stopped everything milk and milk related, and I started having milk because I was craving for milk and paneer during my last trimester. So then I would go with what I'm feeling and what I feel, what my intuition is telling me to eat and drink. I would do that. And again, after 3 months, I didn't feel like having milk. I stopped having milk again. But also with Reba, she would keep, checking in that, what is it that I need for that movement. But I think Donna was covering every bit of it, so I hardly had to even talk to Reba also. But Reba I could reach easily over a call. More so it was to do with emotional because we had gone through a loss. It was more so to do with the fear of losing this pregnancy also. So physically it was all good, but it was to do with just mental and emotional support. And in the last couple of weeks, I had also kept my good friends around who were there around me in my area prepped that my husband might call you. And I had told my husband also, if you need any help while I'm in labor, call any one of them, call them. They would be willing to, be there in person also. So I think there was some time that one moment during the labor that even he was getting frustrated. So he went out, he made a call to one of my friend, and my friend, just told that do so and so things, and then he came back and he was fine and he was ready to, go on with the support. And trust me, he has never been this patient ever in his life. He was so patient during those hours. So yeah, super supportive during labor. Postpartum, I wouldn't say that, but but during labor when I needed somebody, he was there.
Yeah, definitely. So companion as he is.
Yeah.
Sisters, if you have any questions, you can write it down in the chat box so that Preeti can answer. And I had a question, Preeti, that um, the endometriosis which you had and the steaming which you did, how was the result for you? And
So
how did that lead to a natural conception?
So, like I said, that just in 1 month of steaming, my pain was completely gone. So, I never went in for a sonography because it was like the signs and symptoms are telling me that things are getting better in my body.
Mm-hmm.
So, post that pain that went away, I started consciously trying to conceive. It took us a couple of months to conceive, but it was a natural conception. So when I went in for a sonography at my 12th week, I told my gynaec to see whether the cysts are still there. he said there are no cysts.
Oh, wow.
So it was almost a 6 month gap since I started with steaming and when I conceived,
Okay.
and it was all gone.
So how do
One,
you, yeah,
1 second. Huh?
there. Yeah, sisters, if you have any questions, you can ask about steaming to her. You can also write down.
Hi, I'm Sumisha.
Hi,
I'm
Sumisha.
from yeah. So I've been doula like recently certified with Amani.
Oh,
I've been
wow.
like three amazing VBACs to attend. It was terrific.
Okay.
One was accidental home birth.
Mm-hmm.
Yeah, and then I have some questions for Preeti.
Mm-hmm.
Uh, um,
So,
Preeti,
yeah, so Prity isn't there. She just took a break for a minute. I think she's attending her daughter. So while she's back, then you can ask her the question. Lovely
okay,
to have
okay.
you, Sumisha. Where are you based,
Yeah,
Sumisha?
UAE right now in Alain.
Okay.
I'm from Kerala.
Acha.
And I'm a full-time researcher in UAE University.
Okay.
So again, like all of us, like most of us, like my own birth story paved the way to be a doula for me.
Yeah, alhamdulillah.
Yeah.
So
So
Prity,
I'm
Sumisha
about,
has a question for you. So yeah, Sumisha, go ahead.
hi Preeti, can you hear me? Are you there?
Prity, you're on mute.
Okay, sorry. Yeah, I'm here and I can hear you.
Okay, awesome. So now I've heard your birth story, terrific. It's like full of perseverance and complete dedication. Hats off to you. Like I always like admire those motivated moms, like when they come to me also like for VBACs. So, do you support women now, like who are on VBAC journeys as a doula?
Like I said, I'm a postpartum doula. I'm not a labor and birth doula. So my journey starts after the birth happens. But if there are moms who reach out to me, I am always there to talk to them, to guide them to these support groups that I was a part of, and to ask the right kind of questions to their care provider. So that is
Right.
how somebody is getting in touch with me. I am very much open to sharing my story with them, motivating them, guiding them if they need any kind of support.
So, like when you did your debrief about your VBAC, did you have anything you think that you could have done differently or you could have done in a better way? Do you have any such thought?
No.
Mhm. Okay. So, and like now again, when women come to you, so what is your actual stand on epidural? Like I know it worked for you well, but like again in the future when people women come for you for support, would you be more aware of the negative sides of epidural and how it can impact a VBAC. Luckily, it went smooth for you, but then it's not always the same with like epidural. So, did you do a thorough study, or do you still want to, like, do you want to know more about epidural? And like, when women come to you, like seeking for VBAC, would you tell them more?
Yes. Firstly, I would love to know and educate myself more on epidural. And for me, like learning is a journey for me. I never stop learning. So every time I'm coming onto a topic, I keep educating myself because there are so many women that I come in contact with, and while I'm sharing my story, I'm also kind of educating them on it. But for me, like I said, I wanted a VBAC, and there are so many stories that I've heard of natural births, not VBACs, but for their first births also, wherein the epidural, because they took an epidural, they were able to have a natural birth. So yes, there are side effects of everything. There are side effects of getting induced artificially. There are side effects of epidural. There are side effects of C-section also. So when I weigh, there are more side effects of
Yeah.
C-section than an epidural. So which is why I chose that. and it is up to an individual, or it is up to a family or that mother what she weighs more.
Yeah, right. So, yeah, awesome. No, and just because you said that how particular you were about your diet and you didn't want any like artificial, even multivitamins going into your body, I was quite surprising for me. Like when you like, yeah, we need to weigh out like what is good for us at that time. Anyway, it was terrific journey, and I feel like more women like you should come to like be birth and postpart like birth and labor doulas so that you can support more women around because from us, like women from our own journey, that passion which stems out from that is very different.
Yeah, that is true. And that was my plan initially to, because I wanted to have a birth center here around Mumbai.
Yeah,
I
awesome. Yeah,
said I want to be a doula, and that is how I got in touch with the doula collective, and I attended one session. But for me, again, it was weighing what I want more. I wanted to become a mother. That was more important for me
exactly.
than to be able to support other mothers, and which is why I didn't go ahead with becoming a birth doula. And I said I cannot help mothers during birth, but I can still help them for their postpartum, which is also huge. When it comes to labor and birth, there are
Yeah,
still so many people who are there to guide, but when it comes to postpartum, nobody really preps you up for it. That what is it that is coming in your postpartum? So,
yeah,
which
right.
is
That's
also I
yeah,
feel is major, and I wanted to
yeah.
be a part of that. So, and now that I am a postpartum doula, I don't
Mhm.
think I miss anything, and I want to go,
Right.
and or
Yeah.
I dream to become a birth doula. I think I have enough huge a role to do
Mm.
when it
That's
comes to
100%.
helping
Yeah,
moms with postpartum
exactly.
also.
Yeah, postpartum is very important. Like very, very important. Most of the urban women they miss out hugely on that postpartum journey.
Yeah, yeah.
Like
Don't take
I
it
have
serious.
heard from I've heard from my own sister after her birth that she said she was crying one day and she felt so lonely and she said no one told me that this is more difficult than the birth. And I was
Yeah,
like,
Yeah.
yes.
yeah.
So
That
yeah,
is
we
what
do
I
need
say, that when
support around the postpartum.
during pregnancy, there are so many people who will keep telling you कि ये खा लो, वो कर लो, ये पढ़ लो, ये कर लो, but postpartum में nobody comes, huh?
Yeah.
Yeah.
Instructions देने आ जाएंगे कि सलाह देने आ जाएंगे कि ये कर लो, इससे अच्छा हो जाएगा, but actually to come and help you and support you, there would be nobody.
Yeah, luckily, if you know, I don't know, like in Kerala, postpartum is taken very seriously. Like, regardless of the socioeconomic background, they are given a 40 days complete rest with
Hmm.
all the Ayurvedic massage, steaming, and everything. Like, even the baby mother is given complete rest. She's given all the herbal concoctions, medicine, lehiam, like whatever you say in Ayurveda according to the Garbha Sanskar.
Hmm.
So that's awesome, yeah. I wish like every place they have that tradition and ritual.
Yeah, yeah. So also in this day and age, women
Yeah,
our age, they don't want to believe anything blindly.
Hmm.
Even if our parents or our aunts or our grannies are telling us, ye karna hai, I think most of us wouldn't want to do blindly until there is some science behind it, or until there is some reasoning behind all of these things. Only a few of them would kind of blindly believe, ki, okay, just because my mom is telling me I need to do this, I will do this and follow it to the core. So,
yeah, it goes with everything. Like,
Yeah, and I think also there are two
each level.
extremes. We do not want to follow blindly. फिर तो फिर कुछ भी हो जाएगा. And then again, जब हमको करना चाहिए तब हम नहीं करते. Again, that is again कि हम we are knowledgeable or like we are educated tribe and we want to know ये क्या बोल रहे हैं and stuff like that. So definitely. So, Sumisha, are you done with your question?
Um,
So that I can
amazing
answer.
books on postpartum, like which is like 100 years old also.
Yeah.
Like even Rachel Reed has done like a terrific work on postpartum, like how much it was important for women's entire health, like her yeah, entire health, like for 40 years or like for all of her life is determined by her postpartum.
Yeah.
Yeah.
I have heard Priti saying your 40 days is like your 40 years, something like that. I have
Yeah,
looked
yeah,
at some
yeah,
posts.
yeah.
Yes,
So,
yes.
Preeti, I have this question that do you do steaming like the pregnant mothers, are they supposed to do steaming throughout their pregnancy?
No, it would start 36 weeks onwards.
Okay,
Also, under the guidance of a care provider or a certified professional only, and not just by themselves, because there are certain herbs which are being used. The herb blends are different when it comes to labor prep, the herb blends are different when it comes to postpartum. Herb blends are different when it comes to you if you want to alter your cycles, if you have short cycles, if you have long cycles.
okay.
So the herb blends are different for everything.
So, do you mean to say that all the females, like yeah, you did mention that teenagers can also use
Yes,
this blend?
teenagers can also use, yes. So the herb blends are according to the menstrual cycle, and what are the issues that you are facing, and what is it that you're looking at from this practice. Accordingly, I will make the herb blend and send it across. I don't have the herb blends ready
Hmm.
packs that that you order and I immediately send it to you.
So people can contact you, have a consultation done, understand you understand their menstrual cycle, and then the blend is ready. And
Yes.
so, do you have any story of women using doing steaming and getting results? Like yours is one, but anyone apart from that?
Yes, lot of stories I would say. Uh,
One
just
one
couple
of
of
that
days
story which
back,
is like wow, what
yeah.
about me?
So just I have a lot of wow stories, but just couple of days back there was one lady in the east. She had gotten in touch with me and she had taken my herb blend. So I just reached out to her that in general to check how was the steam session for her, and she her periods were not regular, and she told me it's been in just 1 month of doing that steaming, I conceived naturally, and in that just 1 month, my cycle came to a 28-day cycle, and I conceived naturally just the next month.
Oh, wow.
So, regularizing is uh, pretty common when it comes to steaming. If you are doing all these practice regularly, even yesterday there was one client, she had her periods very late, 40 days to 60 days. Anytime
Oh,
between that, she would get her periods. Since last two cycles, she told me yesterday that now the previous cycle was 32 days, this time the cycle was 34 days, which is amazing to get that cycle from 60 days to 34 days or even 40 days to 32 days is huge. And it is not just to do with this. There are so many symptoms that comes around your periods. One of my clients, she was telling me that she had pain in just one leg,
one leg.
and one side of her leg, yes,
Acha.
on just the right side
Hmm.
during her periods.
Hmm.
And even she did this, and in 1 month the pain went away.
Okay.
When some pain or some things are coming up, discomfort just around your periods, it is to do with your hormones, and it is nothing to do with your physical health. So how you balance your hormones,
Hmm.
your symptoms, those are around your periods, even that would gradually keep going down. There are so many women who tell me that after seeing the symptoms around their PMS, that went down drastically.
Okay.
So my
So how
whole
is this wet
So,
steaming different than the dry steaming which we used to do in postpartum? The coconut shell burning with some charcoal, and is that
yeah,
different with the steaming which you do?
a lot, a lot. What I do is I take water as a medium,
Hmm.
boil the water and add these herbs to it. So it is wet steam and not dry smoke.
Okay.
Dry smoke that was there with charcoal and certain herbs over it, that would also have some drying effects.
Hmm.
Hmm? While water as a medium in itself is moisturizing.
Hmm. Hmm.
So
Hmm.
it is also going to help you lubricate. It is also going to help you nourish your organs around in the perineal area
Hmm.
and not kind of dry it off completely. Also, in this day and age, to burn charcoal where we have kids around us, we won't be able to do that easily. Here, you hardly have to do anything. You boil water in your teapot or over the stuff, you pour that into a bowl, add herbs to it, and then you just steam over it. So I have a box that I've made, a steam box,
Yeah.
and you just sit over it comfortably. There is an opening which is there.
Hmm.
You can sit over it, and the steam comes just around your perineal area. So there are no chances of you getting hurt, or you getting a lot of hot or warm heat. I've tried the dry smoke also during my postpartum around the first time, and it is a lot. You cannot control the temperature of it. Of course, you cannot control the temperature of the water also, but with water, until it reaches certain level, you're supposed to start only after that.
Yeah, so this is, I think, Priti, I'm sharing your pictures,
Yeah,
the beautiful box that you have created. So
yeah.
this is the womb story. The Priti is
That's my
she's
brand.
the founder, yeah. And this is the steam box which is she's talking about, and the vessel which has hot water, and then you put it inside, and then you sit over it, right?
Yeah. You can share the next picture also, because that has an opening and which is a little clearer.
Yeah,
Yeah, so if you see the opening above, there is just that much of opening, and you can just sit over it, and the steam comes just around your perineal area.
correct. So I have one last question, and then we'll take your view. And Priti, what about pregnancies, which like the women who go miscarriages, and there are women who have ectopic pregnancies, and then the pregnancies, then the fallopian tube, and sometimes the tube has to be removed. Have you come across any woman who had one fallopian tube and she did get pregnant, or any healing around the fallopian tube or the pregnancies with the help of steaming?
I have come across women who have had miscarriages, but not across women who have had their tubal ligation done, or the fallopian tubes blocked. I've come like natural miscarriages that have happened, and any miscarriage or a termination of pregnancy, irrespective of whether the baby is there or no, or even if it is a stillbirth, postpartum still remains the same. Whether you have undergone an abortion, whether you have had a miscarriage, whether you have had a stillbirth, postpartum still remains the same for everybody. So, which is why all these practices are all the more important when it comes to miscarriage, irrespective of whether the miscarriage has happened in the first trimester or second trimester or the third trimester. And when the steaming is done, especially after a miscarriage, if there are any remnants which are there of the placenta, it helps to even release that. Just give me one
Yeah,
moment.
yeah,
You're on mute, Sneha.
so I said that, yeah, this the miscarriages, the woman who undergo miscarriages, this would be definitely very healing, to the womb and to her experience and overall, So there's a question from Stanjum that I recently heard that in normal deliveries they give anesthesia and cuts. So what about natural? What exactly happens? What happens in perineum?
You would like to answer that, Sneha?
So are you asking that a normal? What about natural delivery, Anjum?
Yeah, I've heard that they get through cuts while delivering. So, I mean, natural birth, what happens? Does it get stirred, or I
So
mean, does
that's
the
that's the
area
nat.
gets broad? What happens in natural birth as compared to normal?
Yeah. So many natural birth mothers, they do not choose to have an episiotomy done. So when there is no episiotomy, there is no manual cut which the gynec does. Yeah, definitely, but the opening, the perineal does stretch, and but the perineal again, with some steaming or some warm water there, it gets heals because there is no suture made there. So in normal delivery, when you go in a hospital protocol, the episiotomy is there until unless you speak to your doctor and you make sure that you do not want the episiotomy. If not, then if you do not get the episiotomy, then the healing, I think, it is much faster and better with some warm sitz bath or steaming like this.
So you mean the natural tears gets well by itself easily, right?
Yeah, yeah,
And it gets back to its normal, I mean, size as
yes.
compared to the normal one, right? Because I've heard a very painful story from my one of relatives whose stitches have been in fact opened after a year. So it's very, I mean,
Stitches have been
difficult.
open after the year.
Yeah, because it was not done properly, and she got three stitches, and it's still, I mean, problematic for her even after years. So I mean,
So
the
I think
natural tears are
Preeti can
better,
tell
right?
about yeah, Preeti can tell about how that can be helped with steaming, right?
But
The
I
perineum.
think stitches open up even if the sutures are resolvable. They resolve on its own, and the healing happens naturally. So I don't understand when you say the stitches were open,
Yeah, the
because the
one, I
stitches
mean, ek
needs to
taka
be
bole
open.
khul gaya, and it is because I maybe the one who did it was not that professional also, so they got it.
But
They
the
got
stitches,
she got knots, and one got open. Uh, and it
But
is
the
still
stitches are
painful.
going to be open, right? वो stitches खुलेंगी ना जब steaming
नहीं
हम
नहीं
करते हैं.
स्टिचेस खुलेंगी बट जैसे वो एरिया बड़ा हो गया है और एक टाका तीन टाके लगे थे तो एक जैसे हील ही नहीं हुआ
अच्छा.
वो खुल ही गया तो वो एरिया ही बड़ा हो गया है एंड द पेन शी हैव बीन थ्रू आफ्टर दैट जो बहुत ज्यादा हुआ उनको सो आई मीन जो नेचुरल बर्थ में जो टीयर होता है वो बहुत ज्यादा होता है कि वो थोड़ा बहुत टीयर होता है या आई हैव हर्ड कि किसी किसी को टीयर होता ही नहीं है पटता ही नहीं है ऐसा भी सुना है मैंने
Yeah, I
इज
have
इट
seen births, water births where there was no tears, tear, or like home births where I saw that I saw the perineum opening for the baby to come out, but then there were no tears.
Okay. So it gets back to normal, right?
Yeah,
Because
yeah,
that was a scary part for me. Natural birth.
Yeah,
definitely.
I didn't go through a tear when I birthed. It
yeah.
was
Oh,
just few
barakallah.
cuts here and there, but so most of the times you're not going to tear. Your perineum stretches out and then it gets back to
Okay.
normal.
Yeah.
Exactly.
So thank you so much, Preeti, for being there. And definitely, I stay near Preeti, but I haven't experienced
Mhm.
steaming yet. So Preeti, can you just tell me about the box? Like, if someone is interested to have it, what is the cost of it, and what is the consultation thing? How do you go about it?
So I start with the consultation, like I said, to understand the menstrual history better. Just even when it comes to postpartum, the postpartum blend for all the mothers would be the same, but
Mhm.
I need to know to understand how frequently you need to do the steaming, which is why I need to do a consultation to know how your menstrual cycle was before you got pregnant.
Mhm.
So accordingly, I can give a steam plan, like how a doctor would give you medicine that कि ये medicine 3 time लेना है, this medicine you need to have for so many days.
Yeah.
The steam plan would differ then in that case. So which is why I start with the consultation. The consultation charges are 1,000, which
Okay.
is all on Zoom,
Mhm.
which is minimum 30 to 40 minutes. It generally, most of the time, it goes longer because there is so much that we
Yeah.
have to share and we have to talk about. So it goes to 1.5 hours also, but minimum time is 30 minutes.
Mhm.
And the herb blend is 1350 rupees. That is for 10 steam sessions. And the steam box is for 8,200.
Okay. So the box is made out of wood. It's
Solid. Yes, it is made about the best solid wood that is there, which is used in ships, because in ships also, because ships are in water
yeah.
all the while, the wood has to be something that doesn't warp or doesn't shrink. So even here, because there is going to be steam inside,
Mm.
I've used that same wood here so that the wood doesn't warp or wood doesn't shrink in any ways. But after the steaming is done, I keep the box open just to dry it out naturally. And also, this box is something, if you see any kind of wood that has a polish over it, like a chemical polish,
Mm.
this doesn't have a chemical polish, this has natural polish.
Mhm.
Because with steaming, if there is chemical polish over it, even those chemicals might start to come up. So, which is why I use a natural polish over it.
Wow.
And this design that I've made, which is a very compact one, which goes in a very sleek box. The first one I made was 15.5 kgs, and this one is 5.5 kgs.
Wow.
So very easy to send it across. This is something that you can dismantle and just slide it underneath your bed or underneath your cupboard.
Okay. Thank you so much, Prity. I hope,
And
sisters, this was new for you, and you would have, you would want to go and know more about it. So Prity is there on Instagram. You can follow her. You can see her work, and if you feel like that you want to experience this, go ahead and get yourself a box and start steaming, because I have heard a lot about it. Insta ID. Okay, Prity, can you just put on your Insta ID, please?
yeah, I will just share my number and my Insta ID
Yeah.
also. And Sneha, you definitely need to come and try this first.
Yes, yes, yes.
Mm.
After Ramadan.
Yes.
Sure, sure. So once again, thank you so much, Preeti. Thank you for having us. So we have recorded this session, and this will be there up on YouTube soon. So thank you for your time, your valuable time. I know that your daughter was wanting you to be there with her. So have a nice Sunday. Take care.
I've just typed my phone number and my
Yeah.
Instagram ID.
So
If
you can
anybody
take it.
wants to
Yeah.
reach out to me anytime, most welcome.
Take care.
Thank you
Bye-bye.
so much.
Thank you.
Bye.